first thing that I try to do when I see a new patient is to understand where they are in their treatment. So I believe that it's much more useful, instead of having a paternalistic approach or simply indicating or not a procedure. I believe my role as a physician is more as a mentor and as coaching the patients throughout the whole range of therapeutic options that they have. So I'm very interested in understanding what are the patient's expectations, where they have been with their treatment so far, and how they would like to pursue in terms of both their time frame as well as the invasiveness of treatment, which their MRI or their imaging studies may require, but we know that there are some patients that they're still not ready or they still don't need a surgical procedure. So I think that's the main difference between providing a comprehensive care for spinal disorders rather than only focusing on my specific expertise as a spine surgeon. I would say a very important part of my patient care is dedicated to both managing and understanding patients' expectations. So ultimately, it's not necessarily the most invasive option which will provide the greatest relief, and especially if the conservative treatments are not exhausted, that shouldn't be the approach. So I deeply encourage patients of trusting that we're taking care of them, we're not only seeing them once and then sending them away, but knowing that we will not be aggressive up front, and maybe the whole care for their spinal disorders may take several months until we reach that point that we need or not to perform a more invasive procedure.